Yeah, so our poll today was, should the bail bill be revisited? We had 16 people voting in the allotted time. Of the 16, 13 said yes, they think it should be revisited. 3 people said no, they don't think there is any need.
All right, thank you so much. All right, let's welcome our guest, the Honorable Minister of Health, Mr. Terrence Deyalsingh. Good morning to you, sir. Long time.
Long time no see. Good morning to you and all your listeners and viewers wherever they are. Very good morning.
All right, so morning to you.
Minister.
Really, it's been a long time. How have you been?
I have been good. I had a very nice weekend. I saw the excellence of this country displayed Saturday night at Napa with All Stars Pan. And then last night I went to Queen's Hall, Brian McFarlane's Joy of Christmas. It was just wonderful to see the excellence we have in this country. And then this morning I woke up to the news that St. Joseph Convent won the secondary school sparring competition. So I'm happy.
Oh, they did win. Oh.
Yeah.
After you said All Stars, I stopped listening, because after All Stars, I had nobody.
Look, let me start no pan fight here this morning.
All right, Mr. Exodus. All right.
Good morning, Minister Deyalsingh.
Morning, Paul. How are you doing, brother?
It's a responsibility where we don't only call you for bacchanal, we call you for sober updates sometimes on the health of the nation. So
Lovely.
You see how responsible we are?
Excellent. And how is Agnes?
She's better than I am. She doesn't have
Lovely.
To...
Good.
All right. Let's start with where we are in terms of the dealing with COVID in the country. I mean, we're not where we were obviously months ago, and WHO has still not declared the pandemic over. Where are we in the country?
Yeah. So let me go into my phone here. So what I can tell you, the latest update I got yesterday with the numbers, and I'll give it to you now. Right. These are Sunday numbers from Dr. Richards. Tobago rolling average of cases is 0. In Trinidad and Tobago, we have 17 patients in hospital, and the national rolling average cases 20, which is extremely low, and only 2 people in ICU. So the numbers will tell you, Paul, that we are on the rapid decline of the acute phase of the pandemic. That decline would have started around May of this year. So between May and this year, cases have gone down steadily. Deaths have gone down steadily. Our ICU numbers have gone down steadily. So that's where we are. And you are spot on. What we are waiting for is WHO to make a declaration that this thing is no longer a pandemic, but that COVID is now endemic in the global population.
I was going to ask that, Minister, when do you expect that announcement to be made? And especially in light of the fact, I think that China had its first death, I think, of COVID in 6 months recorded recently.
Yeah. So let me explain briefly how the decision is made. WHO will rely on a team of 12 experts. They will look at the numbers. I was in Cuba recently on a health conference, and in that conference, there were senior members of PAHO. So I asked the question, what is the delay in declaring it endemic? And what they told me was that they are concerned about the cases in other parts of the world, which they are clocking at over 1 million a day still, especially in Europe. So whilst we in Trinidad and Tobago, which is a very small country, are doing relatively well, they cannot declare COVID and the pandemic to be over, because in other parts of the world, it is still raging, maybe not at those high numbers, but it is still an area of concern. So that is what is preventing them right now from declaring COVID endemic, and we are still in the pandemic stage.
I have a strange question.
Sure.
Now, the deaths have always been the greatest barometer, but how are we sure about our numbers? Because most people, even if they get COVID symptoms, they ain't going to the hospital, they ain't going to the doctor. They're battling it out at home.
Yeah, Paul, that has to do now with the Omicron variant as opposed to the Delta variant. When you had the Delta variant, you had no choice but to seek healthcare. Omicron, which came on the scene last year, December, people can ride this out at home, especially if you're young and healthy. You can ride this out at home. But we still record the deaths because the deaths will come to us, whether you die of COVID or from COVID or with COVID. So the death figures would not lie. But the hospitalization figures, people because of Omicron, which is much less severe, they can battle this out at home, as opposed to Delta.
So we have no way of doing our actual numbers of infections.
It's at this point in time, Paul, it doesn't really make sense. It doesn't really make sense. It will be a waste of resources.
Because it's not really severely affecting people.
No, correct.
And how are we differentiating that from, because I know people get really bad colds and they test themselves and they're negative, or they go to pharmacies and they get tested and they're negative. But there's a really bad flu apparently going around.
Yeah.
Doing influenza inoculation.
Yeah. So we advise people about the differences between COVID, the common cold, and influenza. And we have been preaching this, and we preach this every flu season. So let's take influenza, which we are vaccinating against. It's a combination of viruses, A, B, C, D. A and B are the two important ones as far as humans are concerned. Of A and B, A is the one that causes pandemics, as opposed to B. H1N1, H3N2, and influenza B, we are now vaccinated against that. It's called a trivalent vaccine. So H1N1, H3N2, and influenza B. 3 types of vaccines, trivalent, as opposed to the old days when it was a bivalent. We advise people that the symptoms of the influenza are radically different to the symptoms of a common cold. And I'm glad for this opportunity. Common cold, which you will get if you are vaccinated against influenza or not, is mild. It comes on slowly over time. You get relief with simply taking your paracetamol, whatever, and in 3, 5, 7 days, you get over the common cold. Influenza, however, comes on much more rapidly. You can deteriorate in hours. You can go from being well to being ill to being in an ICU to dying within 24 hours. The symptoms are milder. The fever tends to be milder, but you deteriorate very, very rapidly. So that is what we are vaccinating against right now on every flu season. One of the biggest misconceptions which leads people to believe I should not be vaccinated is that they say, well, I got the influenza vaccine, but I still catch the common cold. Yes, you will. Because the influenza vaccine is against those serious influenza A and B, as opposed to the common cold, the common garden variety flu, which you will get, which is not lethal, which isn't deadly, as opposed to influenza A and B.
Minister, I want to go back to a statement you made earlier concerning the COVID deaths and how you're recording it still, and that there are people who die with COVID and of COVID. How are you determining that? Is it that at the autopsy stage, a COVID test is still being done?
So as the chief medical officer would have explained this over the past couple of years, we don't do autopsies on people dying with COVID or of COVID. So that's why we record them as that. So the chief medical officer is on record as saying how that is done.
Okay. All right.
Minister, with the issue of the vaccination for influenza, of course, you will have come from a period which was very frustrating with vaccine deniers for COVID, which was more virulent and more deaths than I think we've seen in our, at least in our contemporary history. And the groups that were against vaccination. So, of course, that group, I assume, will still be against vaccination for influenza. What is the efficacy record of those influenza shots for people to kind of persuade those that they should really get the influenza? Because a lot of people, of course, didn't get, some people, at least half of the country, roughly, didn't get the COVID vaccine. And they said, well, look, we are fine now, we made it through, etc., etc. Why is that kind of attitude dangerous with influenza?
Yeah, so that attitude is dangerous. Any anti-vaxxer sentiment is dangerous. And we were very concerned at the start of this influenza season that there will be very low uptake of influenza vaccines. Richard, I can tell you, we are not pleasantly surprised. And let me give you the figures, because again, figures don't lie. Our last flu season, we administered 26,000 doses of influenza vaccine. And we thought people will be vaccine wary, vaxxed out. They don't want to hear me. They don't want to throw me in the dustbin, come and talk about vaccines again. But Richard, we are quite pleasantly surprised. The figure up until Thursday evening, when I spoke on Brian Lara Promenade Friday, was that we had given out close to 15,900 doses. So we gave out more than 50% of last year's total, which was given out over a 6-month period in 3 weeks. So it means that the figures tell you people are taking it seriously. They are not vaccine wary. So I am extremely happy for that. We did outreaches on Saturday. I was at the Wesleyan Church in Penco Street, Montrose on Saturday. We were at Trin City Mall. We were at the Mount Lambert Community Center and other outreaches. So I will get the figures when I go in this morning. Hopefully we have crossed 17,000. But this year's flu vaccination uptake has been really, really good. One population that we always have trouble every year is the pregnant population, because they feel that the vaccine will hurt them or their unborn baby. It's a normal feeling for a mother to have. I can't blame them for that. But we educate them in our antenatal clinics. Look, the vaccine, as Dr. Parkinson explained on Friday, doesn't cross the placenta and doesn't get to the baby. What gets to the babies are the antibodies that are generated within the mother's system. That crosses the placenta, gets to the baby, and so protects the baby. So the baby of a vaccinated mother is protected. And we want to encourage our pregnant population, most of whom come to our antenatal clinics, over 94% of the pregnant population, and the other 6% who go to their private doctors, physicians, get vaccinated. It's good for you and it's good for your baby, because I can tell you, when I get the reports of pregnant women in an ICU struggling to stay alive because they are unvaccinated, it's not a nice place for a mother to be. It's touch and go for a pregnant woman in an ICU who is unvaccinated.
Mm. What about children accessing the influenza vaccine?
Yes. So again, let me just go into my phone again. I have all those data in my phone. I can tell you offhand what is going on there. So what we do, we encourage people over 6 months to get vaccinated. And we try to tell people that 6 months, the two most vulnerable groups are children, 6 months to 8, 9, 10 years, and the elderly. So what we are trying to do at this point in time is encourage as many people to get vaccinated. I'm trying to find the figures. I'll come back to you when I get it, right? But we are encouraging people. Yeah.
Yeah. Is it being considered at all for because I mean, us growing up, the nursing personnel will come to schools and so on. Is that something that happens still?
No, times have changed. When you and I were growing up, we were not a very litigious society. And the issue of parental consent was not as developed as it is now. So you hardly find us going into schools and vaccinated children without parental consent. When I was growing up, you come in, you get vaccinated, you go home and tell your mother and father, well, I got vaccinated. And they will say, congratulations. Now, if you do that, a lawsuit will follow. Right? Okay. So times have changed. We have become much more litigious. So we encourage parents to bring in your children to either the outreach programs or the health centers as listed in the Ministry of Health.
Is the paddock still a center?
No, what we did, we ran the mass vac sites for the first 2 weeks. That was done for people who engage in what is called health-seeking behavior. In other words, they will seek out healthcare. They will seek out the vaccines. After you get over that group of people, you now have to go to that group of people who need the encouragement and who need the convenience. So instead of them coming to the vaccines, we are now going to them with the vaccines. Because in mass vax, the numbers will start to drop off after the first week and a half. So that's why, as I said, I was at the Wesleyan Church in Penco Street. We were at Trin City Mall. We did 78 on Saturday. We were on Brian Lara Promenade on Friday. We did 92. So we are at that phase now where we are going to people who need convenience, who want it at their doorstep, who want it where they are, as opposed to them coming to a mass vac site. It's different groups of people you target over time.
Mm-hmm. It's interesting you say that, and that you're pleasantly surprised as to the uptick in influenza vaccinations, but shouldn't it follow through? But because I'm thinking, while you and the government would have wanted more people to take the COVID-19 vaccines, we got to just over 500,000. Am I correct?
Correct.
Right. So I'm thinking that over 500,000 are people who will take almost any vaccine once it's safe, because they have taken a vaccine that was developed quickly and felt safe with it. Yeah. So I'm thinking you have that cohort of people who are not vaccine resistant or vaccine hesitant for any safe vaccine.
Yeah. So there is a difference. If you look back at influenza vaccination rates over the years, when I came into office, the previous government will bring in about 6,000 doses a year. That is what they would administer. When I came into office in 2015, that year was particularly bad, and we ordered significantly more. In my 10 years Minister of Health, the maximum we ever administered was 125,000. And the minimum we ever delivered was last year, 26,000. So it doesn't mean that everybody who took a COVID vaccine is going to take an influenza vaccine. The numbers don't.
No, I'm not saying they will. I'm saying the potential for it once the message is right is there.
Yeah. What tends to drive influenza vaccine uptake, as it did in 2019, is deaths. That was the year we had 41 deaths. And that is the year we did 125,000 doses. This year, we have had 5 deaths. Last year, we had no deaths, I believe. So the public tends to react to the news when they hear people are dying. So the year we had 41 deaths, we did 125,000 doses. Last year and the year before, during COVID, there were virtually no deaths because we were so clean. We were wearing masks, sanitizing. Travel from North America to here was suspended. So the influenza didn't get a chance to migrate here. This year, the number of deaths at this stage of the flu season is relatively low, only 5. But that is no comfort to those 5 families. So we encourage people still go out and get vaccinated, because influenza, as opposed to the common cold, is deadly.
Are there any groups that are more at risk?
Yes, thanks. So 4 or 5 major groups we always advocate to get vaccinated. 1, healthcare workers, obviously, because you are working in an environment, in a hospital setting, health center setting, where people with the virus are coming to you. 1. 2, the pregnant population. 3, those over 50, especially with comorbidities like myself. I am diabetic, hypertensive. Children 6 years and over, 6 months and over, get vaccinated. People who are asthmatics and so on, get vaccinated. So we encourage all those vulnerable groups, whether it's by age or by your occupation, like healthcare workers, or like condition, whether you are pregnant and so on, get vaccinated.
And how long should one get the vaccine after COVID? For example,
2 weeks. 2 weeks.
2 weeks. Okay.
So whether it's COVID or the flu, if you have flu-like symptoms, wait for 2 weeks after your flu-like symptoms disappear to get vaccinated.
Is it the same COVID-19 vaccine card that you can carry?
No. So the influenza vaccine is not a mandatory vaccine, compulsory vaccine that we need to record for legal purposes on your card. However, if you have your card, take it in so you have a record. If you don't, we give you a separate card that shows that you have been vaccinated against the influenza vaccine. You don't need this like for travel purposes to be recorded. You don't need this to get into school to be recorded. But if you have your card, it is good for your own personal records.
Now
you started talking influenza and I started sneeze, yes?
You mentioned diabetes and hypertension, and I was I wasn't surprised, but I was happy to see at Trinity Mall this weekend persons doing the diabetes testing, the Ministry of Health out and about. And what came out during the COVID-19, the really severe part of the pandemic, was certainly persons with NCDs being more at risk. I saw a graphic from the Ministry of Health earlier last week, I should say. Give us a sense of what the state of plays, because the numbers were startling to me. The percentage of the population with diabetes and where we are.
Sure, thanks. So let's start with the numbers. The estimate of diabetes prevalence in Trinidad and Tobago is about 15%. That is 15% of the population is thought to be at some stage in their journey towards being diabetic, either pre-diabetic, diabetic, type 1, type 2. So 15% is just over 200,000. But that is an estimate. So what we are doing now that COVID is on the way down, we have started back our outreach program. So again, you saw it in Trinity Mall. I was at the Wesleyan Church on Saturday. So we have started back these outreaches, testing people and alerting them of whether their numbers indicate that they need further investigation. So at these testing sites, we will do your random blood sugar. They will ask you when was your last meal and so on. And that will give them a fairly good idea of whether your blood sugar is within normal range. If it's abnormally high, we will refer you for further testing and screening. You are invited to join our diabetes clinics, or you could take that information to your private practitioner and get the necessary advice and or treatment in both the public or private sector. So that is what we are doing right now. We have NCRHA under its program. They have done about 50,000 screens for all sorts of things since we started back after COVID. The other RHAs are doing the same thing, ERHA, back onto the communities, Southwest, Northwest, and Tobago. So we are getting back into the communities so that we could screen people. The first step is screening. And then we give you the advice based on that screen, what you need to do further.
Something that Richard has raised continuously, Minister, the issue of restaurants and even fast food outlets and even vendors putting up a calorie count and these kind of things as to what the foods they're serving contains. Is that ever been considered in terms of legislation?
No, it is difficult in our society to legislate that. However, thank you for raising it. We have a revitalized food advisory committee. And I met with them about 3 weeks ago, and I tasked them with the job of coming to the nation in December with food recommendations and how to manage their caloric intake, because we simply taking too many calories for the lifestyle that we lead, which tends to be sedentary for some sorts of people. We eat too much, our portions are too big. And one of the things we have to overcome is telling people, look, we are not asking you to starve yourselves to death. What we are asking you to do is do things in moderation. But at the same time, step up your exercise activity, walk 4,000 to 7,000 steps a day, download a pedometer on your phone. I look at this religiously every day, and I try to average about 5,000 steps a day. Substitute soft drinks with water as far as humanly possible. avoid the sugary juices and thing. And I could tell you anecdotally, because we have to do a survey, I could tell you anecdotally from the information coming to me and people interacting with me when I go, the message seems to be getting there. People are now much more aware since we launched TT Moves and asked people to eat more fruits and vegetables. Do three simple things. Eat more fruits and vegetables, walk 4 to 7,000 steps a day, and drink more water. Three simple things. We are not saying to give up all your indulgences. What we are saying, do these things in moderation, whilst at the same time enjoying life, but walking a little more, drinking a little more water, and eating a little more fresh fruits and vegetables. And the anecdotal evidence so far is that the program seems to be working. But we are going out, we want to survey about 500 people. And again, this were the instructions I gave about 3 weeks ago. Go into our clinics, interview about 500 people. There's a set questionnaire as to people's new attitudes towards taking care of their health, which will inform us going forward from January 2023.
You know, Minister, I'm not so sure why the calorie count issue in terms of foods, vendors or otherwise, and restaurants across Trinidad and Tobago, and Trinidad and Tobago is big on food. Why that is so difficult to implement, because you have major cities that you go to restaurants or wherever, and it does matter because sometimes you're going to choose something, and when you look at the calorie count, you say, let me alter that choice. You do it.
Yeah. So what I have tasked the Food Advisory Committee with is to come up with a plan to talk to these people to get them to do it voluntarily. And I must say, some restaurants already do it. But to go the way of legislation is not something that we are looking at now. The same way we persuaded schools to drop soft drinks from their menu, which worked, moral suasion, and that worked brilliantly. We are going that way. We will be advising people as to how to read food labels. You know, what is, many people don't know what is a serving size. So we tell people, eat 5 servings of fruits and vegetables. But then they will ask about, Minister, what is a serving size? And all of that, I have tasked the Food Advisory Committee to start in December to communicate these simple messages that people can digest, no pun intended, easily, to lead them to eat and drink a more healthy diet.
While moral suasion is great, and to Richard's point, you can't read what you don't have if it's not documented. And in many restaurants and fast food outlets, it's not documented. And the moral suasion path was tried in the UK and the US, and they had to legislate because, as you said during the pandemic, we already have a pandemic of NCDs in Trinidad and Tobago that is undetected. And maybe we need to take legal legislative action to save people's lives.
Yeah, so that is not on my legislative agenda right now. What we are going with is, as I said, with the Food Advisory Committee to educate people. And as I said, the anecdotal evidence, until I get back that survey of 500 people in our clinics, that will inform how we move forward. So we are going to be advising people as to what is a calorie, what is a good calorie, what is a bad calorie, and so on, so they could take the necessary action. One of the groups that we would really like to speak to are parents of children. Parents have a responsibility to make sure that their children's diets are balanced and not only based on fast food, oily foods, fatty foods, and so on.
That's a cultural thing. What a parent believes is healthy. You ain't eating enough, clean your plate. That's very culturally ingrained. So while you may be scientific in your approach as a medical care professional, the culture of Trinidad and Tobago is to have macaroni pie, potato salad, 3 and 4 starches, and 2 meats, and that's a culturally ingrained approach.
Yeah, so that's why I'm saying that the Food Advisory Committee has been charged with that responsibility to start to talk to the population from December moving forward, to give people the information, because an informed person will make a better choice as to what is healthy eating and what is healthy living, what is portion size, and you are quite right, how you divide your plates, into starches, vegetables, proteins, and so on. So that is going to be their responsibility, which I gave them about 3 weeks ago.
Paul, the last man who say eat less macaroni pie get in trouble, you know.
And cool pot and breadfruit.
You see, and I thought Paul was my friend. He tried to walk me down a path.
He tried to set you up.
He tried to set me up. And Paul is your partner, yeah?
One done say have a demon on my shoulder this morning already. Next time say that you're insinuate back and all. What are you concerned about going into the Christmas and Carnival seasons?
Yeah.
The high gathering seasons.
Yeah. So from a health perspective, we are always concerned, and again, we are starting this conversation from early December with the Food Advisory Committee. People feel that they enjoy themselves for Christmas and New Year's, that they should stop taking their medication so that they could eat and drink, and they could stop taking their hypertension medicine because I want to drink. We have this thing in Trinidad and Tobago that if I want to drink alcohol, I have to stop taking my medication. And every year we tell people no, because when I first became Minister of Health, from January 2nd, every year you would see a crowding of our accident and emergency rooms with people whose blood pressure and blood sugar just went haywire. I must say, since I noticed that trend for the first 2 years, we put in place mechanisms to talk to people. And that trend has gone down significantly where we don't see that overcrowding from January 2nd. Because we advise people in our clinics and so on, Christmas and New Year's doesn't mean it's time to stop taking your medication. You can still take your high blood pressure medication and drink alcohol. You can still take your medication and eat. As a matter of fact, it is better if you continue your medication. So that has worked, and we have seen a much less overcrowding of our A&Es from January 2nd over the past few years. And we continue that. We advise people, if you are diabetic or hypertensive, not to overdo it. Indulge a little bit. We are not telling people, starve yourself to death. You can indulge a little bit, but do it in moderation. Monitor your blood pressure, monitor your blood sugar. If you see it going up, adjust your eating, exercise a little more, drink a little more water. Do the common sense things, and we could get through this season without hypertensive or diabetic crises.
Minister, you want to take some calls? Sometimes our audience has...
Of course. That's the best part of the show.
And the numbers are 222-TALK, 222-8655.
Oh,
8255.
Wherever you call it, call the number. Call the number.
Allow me. 222-8255, 612-8255. North Americans, toll free, 866-525-1099. All right, that's our numbers directly into our studio.
Minister, don't understand. That's what the permanent secretary for, to do the numbers.
Exactly. Paul, that background picture you have there, is that your house?
Yes, it is.
Oh, nice, man.
In another imaginary life.
Very good.
That's a virtual background.
I know, I'm just kidding you.
It's in an imaginary life.
Yeah.
Yeah, so we're inviting your calls if you have questions or suggestions or comments to Minister of Health, Terrence Deyalsingh, who is our guest. So, are you worried at all about the carnival season coming up?
Not particularly. I will be worried if we get a new variant. That is but we haven't had a new variant now for close to a year. The last new variant was Omicron in 2021. That's my main concern. The other main concern is influenza. So that's why we want people to get vaccinated, because with Carnival, more people from North America and England will be coming down here. And whatever viruses are circulating there, they will bring it down.
I congratulate you on the ministry. We have not had one case of monkeypox in this country. Knock wood.
Well, I can't take any kudos for that.
If it had 2 cases, they'd blame me, so take some kudos.
Well, yeah. They would have blamed me and called for me to be fired.
They'd have blamed you.
Ministers only get blamed and we get fired.
Preemptive and screening mechanisms work. So
but as I say, we have no known case of monkeypox. No known case.
Minister, has that debate on where COVID came from and how was it started? Has that ever gotten traction?
Well, I think the question is, has it ever been proven where it came from? Yeah. The scientific papers that I read hasn't pinpointed a definite source. We know it jumped from bats to something to humans, and that something is what is missing now.
Okay.
Right?
Is it established that it started in Wuhan in China?
Again, the scientific evidence, the jury is out, and I await the scientific community to make that decision, to make that call.
All right, let's take this call here. Good morning.
Hi, good morning. Good morning to the panel and the Honorable Minister.
Morning, sir.
Morning.
The Minister state, give an update. What is the status in terms of the promised payment to the healthcare workers? Is it on before the end of the year still?
Yes.
That's a good question.
Yes. The answer is yes.
So they will be getting it before the end of the year?
Yes.
Okay. He might be a health worker, you know. So he.
No. I am not entitled to it at all.
No, not you, Minister. The caller.
Oh, the caller.
Yeah. All right. Katie is asking, can you ask the Minister if the influenza vaccine uses the new mRNA technology, and or is it still the old type vaccine?
Yeah, good question. No, it doesn't use mRNA. This is the old dead virus platform that has been used for decades. So it's the old platform, old as me.
It could be worse, could be older than Paul.
Well, I heard the other one talk about you, so anyway. Minister,
that's Wendell.
Let's go in the direction of breast cancer and prostate cancer screenings and how that is going for Trinidad and Tobago's population.
Yeah. So the top 5 cancers in Trinidad and Tobago: prostate, breast, cervical, lung, colorectal. So we have started back our screenings now that COVID is on the decline. You would have seen, I don't know if you saw the Saturday's Express, we had a double-page spread about what we are doing, more specifically for lung cancer, early detection and treatment. But that machine that we got down also does early detection for all types of cancers. What we want to move to now is a dedicated suite of equipment, especially a dedicated CT machine alone for early detection of cancers, especially lung cancer. So that's what we are moving to now. Early detection, early treatment.
Are people heeding the call to go for early screenings or regular screenings as the type of cancer may require?
Yes. Now that we have started back screening, the answer is yes. And again, you can subdivide a population roughly into 2 types. Those who engage in health-seeking behavior, who see about themselves, and those who do not and need some encouragement. So the health seekers, through the RHAs, through the Cancer Society of Trinidad and Tobago, who they do really good work as an NGO. We encourage people, and they have their cancer screening, we have our cancer screening, and all the data goes into one central database. So for men, prostate cancer, get tested, get screened for prostate cancer. One of 2 ways, either the rectal digital exam, or you could do the blood test, the PSA. If you don't want to do the digital rectal exam, the blood test. For women, go and get your mammograms done. Cervical cancer, you can do your screening, and so on. One of the cancers that is emerging globally that is difficult to screen for is pancreatic cancer. That's a tricky one, and I can probably get an oncologist to come and talk about that. But that's an emerging one out of the top 5 that we need to pay attention to, pancreatic cancer. And the John Sabga Foundation, and let me congratulate them, they are doing a lot of wonderful work in raising awareness about pancreatic cancer.
I know the issue of colonoscopies.
Yeah.
I know that from age 45 plus, you should really be checking that at least once every 10 years.
Yeah, for colorectal.
But Trinidad and Tobago doesn't really have a culture of doing that.
Correct.
And many insurance policies don't cover the cost of it if you were to go to the private sector. Is the public sector doing it? And can people seek it out there, or do you have to go to private sector?
No, we do it, but on referral. So we will ask anybody who wants to get it done, join our clinics, and we can get it done by referral. It's not a walk-in service.
One of the big...
Hold on 1 second, Paula. I've had a call here holding for a while. Good morning.
Hi, good morning, everyone.
Morning.
Minister, hi, morning, Minister.
Morning, sir.
I knew that there was a recent push to mental health centers that you all had launched. I am just calling to find out, if that has resumed, one, and two, whether or not there is, what's the uptake on that? Because recently I've had the experience of having to refer someone to get it done in the Chabonis area, and the earliest appointment is like next year, April. So I'm just wondering, what's the resourcing like for those mental clinics, like stress clinics, etc.
I'm glad Katie raised that, Minister, because I was just also about to ask a question along those lines, because we have had recently a couple suicides, people who have committed suicides for one reason or the other, young people. So I'm glad you raised that. So you can answer.
Yeah. So as Minister of Health, we tackle the whole issue of mental health from the point of view that we needed to decentralize mental health services. The old model which we inherited was one where mental health was seen to be something that you needed to be institutionalized for. You go up to St. Anne's, you put you there, and you stay there for 30 years. We started the process of decentralizing mental health services back in 2019 under Dr. Hayes Lothello. That has resulted in a decrease in the population of St. Anne's Hospital from 1,000 to about 750. It means more and more people can be treated in their communities. So we are moving fast as humanly possible, to treat people with mental health conditions in their community settings, where they can continue working, where they have community support, family support, instead of being locked away in a sanatorium. In addition to that, to make mental health services more accessible, we launched something called Find Care TT. It's a web-based approach to mental health, where anybody with a mental health condition can go into Find Care TT, and you have access to over 30 mental health providers, from Children's Authority to the helplines, to the 5 RHAs, to Red Cross, to everybody. So we urge people to make use of these services as far as humanly possible. But the big issue, Wendell, Paul, and Steve, with mental health, as you know, is that people necessarily don't recognize that I am suffering from a mental health condition. Yeah. And that is where the issue comes in. And then even if you recognize the stigma, you don't want to be deemed as being mad. You don't want to be deemed as being crazy. It's the same type of stigma we had with HIV/AIDS, even with COVID. So we need to sensitize people, and we do that through Dr. Hazel Othello's unit. We had a big outreach recently in ERHA, and each RHA does these. I was there at one of the other places of worship. We do that so people could recognize that they need help and seek help. But we urge family members. One of the crucial things in mental health is support. Yeah. Support from your family members, your co-workers, and so on. Not to stigmatize you as being mad, but as someone who needs support. Because I always make the point, we never ask somebody to snap out of diabetes, but we tell people, snap out of your mental health. Mental health needs our understanding and our empathy that these people are going through something that I don't understand. Yes. And because I don't understand it, I need to support you even more. No family in Trinidad and Tobago has not been touched by mental health.
Yeah. The great health crises around the world.
It is.
No, I'm changing gears here now, is the issue of the abuse of psychedelic party drugs It is a growing concern in North America and Europe, and we've seen pictures and videos of people in Trinidad and Tobago stumbling out of parties, juve parties. Ambulances having to revive some of them because they're abusing these party drugs. How concerned are you?
Yeah, so very concerned. I'll tell you what I did. So some years ago, one of the drugs that was being used to drug women was a drug called ketamine. Ketamine is a drug used mainly in the horse industry. And it does have some use in the human medicine. But information came to us and to me that ketamine was being used on young girls and women in parties. They would spaz out, they will be raped, they will be abused and have no memory. So what did I do? I went to cabinet and we reclassified ketamine as a dangerous drug under Schedule 3. So ketamine is much more controlled now, right? We did that, I believe, in 2019, 2018.
But you're talking about the legal access ketamine.
Yes. Yeah. What
that is being.
So I'm telling you what I could do as Minister of Health. So we did that. We are also being very, very careful in our accident and emergencies when we get those reports, how we deal with it, how we feed it in, so we know the size of the problem. But I don't have that data with me now. If I had known we were going down that way this morning, I would have gotten the data. So we feed that into our registry because we have to report these things to international agencies. But there is, in our local party scene, the amphetamines and the uppers that are making the rounds. So we know, again, we educate people. When you go to a party, don't swallow anything that somebody gives you. You may wake up not knowing what happened to you.
All right, we do have a call. Good morning.
Yeah, hi, good morning.
Thanks for holding. Morning.
Yeah, that's, I just wanted to revisit the question that was brought up with Richard with the calories and stuff there. I was wondering, okay, every food vendor should be registered to, and is it possible that a food vendor in the either regional or in the collaboration with Kariri or one of the health things could be given some kind of, they test their food and give a calorie count that they could post on either their media page or on their doubles have so much, and is that a possibility or does it exist already? Because I know if you register your product, does it go through, it should have some kind of testing, a Kariri, I know Kariri goes through that in a standard level kind of thing.
Yeah.
Thank you.
Yeah. So you don't test every doubles vendor. There will be protocols that tell you this type of food is so many calories, that type of food is so many calories, this soft drink is so many calories. And we urge the population, as I said, sorry to be repeating myself, I have charged the Food Advisory Committee about 3 weeks ago to start in December educating people as to what are good foods to eat, what are the portion sizes, what will be the caloric intake that you need for your daily living. So look forward to that sometime in December. They are working on that now because I gave them that job about 3 weeks ago.
All right.
All right. Paul, you wanted to ask a question early on.
I did. Thank you. Thank you, Minister, for being with us. We appreciate your time and as usual.
Yeah.
No problem, gentlemen. Thank you for having me and a very blessed morning to all of you and your listeners.
Thank you so much. All the best to you. Stay safe.
Thank you, Minister.
Recording stopped.
All right.
Of course, Minister Deyalsingh is one of the few ministers who always respond when you send him a message to her.
He does, you know.
He does. He always responds. So thanks for